average American family spends approximately $25,000 a year on healthcare. Premiums, deductibles, copays, out of pocket. That number is higher in Florida for many demographics as well. So let that sink in, $25,000 a year. And for most people, the return on that investment is, hey, we'll treat your heart attack when it comes around, or we'll manage your type 2 diabetes with this medication. Come back when you need a higher dose. Here, we'll prescribe some antidepressants for your hormone-driven mood disorder. That is a reactive system. We are living in a reactive system, and you're paying an enormous amount of money to be caught when you fall, not to be kept from falling in the first place.
Welcome to Health Decoded, your number one source for real health information, with your hosts, Dr. Alessi and Matt Tack.
Health Decoded listeners, if you're dealing with bloating that just won't go away, no matter what you eat, no matter what you try, I need you to hear this. The bloating isn't the problem. It's a signal. Every external symptom you're experiencing, the discomfort, the fatigue, the frustration, has a root cause. And in my years of clinical practice, it almost always leads back to the gut. Nothing else in your body can fully heal until that foundation is restored. I built this framework from my own health journey. I was that patient, frustrated, dismissed, searching for answers. I took everything I learned, refined it through years of clinical testing, and have since helped hundreds of patients achieve complete relief from their symptoms. That became the Total Gut Reset, a step-by-step protocol with one goal: reset your gut in 6 months or less. If you're ready to learn exactly what's causing your symptoms and eliminate them for good, I'm hosting a free webinar where I walk you through the entire framework. The link is in the show notes. Go ahead and register, and I'll see you there. A few months ago, I remember talking with a patient who came to see me who had been in the conventional healthcare system for 10 plus years, trying to solve her health problems. 10 years. And in that time, she had seen her primary care physician, endocrinologist, a rheumatologist, a gastroenterologist, a psychiatrist who prescribed her antidepressants for symptoms that were, as we later discovered, actually hormonal. She had insurance, on paper, really good insurance. She paid her premiums every month like clockwork. When she sat down with me, she had done some math. I remember she had a piece of paper she even brought with her, and she was almost embarrassed to show it to me. Over 10 years between premiums, copays, specialist visits, prescriptions, out-of-pocket costs for things that her insurance, quote unquote, wouldn't cover, she had spent like just over $74,000 on her health. $74,000, and she still wasn't even well. She looked at me and she said, I almost didn't come to see you because I couldn't justify the cost of a cash pay clinic. But then I looked at that number and I was like rocked by this. And this is the conversation that we need to have today, because the question is never just what it cost. The question is, what does it cost to not fix this? So welcome back to Health Decoded. I'm Dr. Alessi. In this episode, this is episode 2 of a 4-part mini-series that I'm putting together. Last week, we talked about the difference between not being sick and actually performing at your best potential. This week, we're going to talk a little bit more specifically about money, specifically why the framing that most people use when they evaluate healthcare spending is backwards, and what the real cost of conventional sick care actually is. I know this topic makes some people uncomfortable, and good, it probably should, because the story you've been told about how to invest in your health is one of the most expensive lies in modern medicine. And it's about what your insurance actually pays for. And so let's start with the fundamental design flaw of insurance-based healthcare. It is not designed to keep you healthy. It is designed to pay for your illness once you're sick enough to require intervention. Think about what your insurance actually covers: visits to the ER, hospitalizations, surgical procedures, acute illness management, prescription medications. Often this comes after a large deductible. Specialist visits after referrals and prior authorizations that can sometimes take weeks. What your insurance does not cover or covers so minimally as to basically be useless is root cause investigation, comprehensive hormone testing, functional nutrition assessments, gut microbiome analysis, micronutrient testing, peptide therapy, bioidentical hormone optimization, preventative protocols used before disease actually manifests. In other words, everything that would actually prevent you from needing the expensive interventions that insurance does cover. Now, let's look at the economics. The average American family spends approximately $25,000 a year on healthcare. Premiums, deductibles, copays, out of pocket. That number is higher in Florida for many demographics as well. So let that sink in, $25,000 a year. And for most people, the return on that investment is, hey, we'll treat your heart attack when it comes around, or we'll manage your type 2 diabetes with this medication. Come back when you need a higher dose. Here, we'll prescribe some antidepressants for your hormone-driven mood disorder. That is a reactive system. We are living in a reactive system, and you're paying an enormous amount of money to be caught when you fall, not to be kept from falling in the first place. Now, compare that to what functional medicine costs. A comprehensive initial workup at Ascend Functional Health, including labs that no conventional physician would actually order, runs a fraction of what most patients have already spent on conventional carousel. A 6-month protocol, all inclusive. It's a number that makes people pause because until they do what this woman did and actually add up what they've been spending, they don't really understand. Now, this isn't a cheap alternative that I'm talking about. We operate a premium clinical model, but the comparison point is not free. The comparison point is those 10 plus years of specialist visits, prescriptions, copays that didn't even really solve the problem. Now, anybody who knows economics or business or these types of terms understands the term of opportunity cost. That's the cost that nobody's actually calculating. And so here is where most people stop the conversation, at the dollar figure on the invoice. But there's a second ledger that almost nobody looks at. I call it the opportunity cost of not getting this right. And I want to walk you through this because when you see the full picture, your framing can actually change. And this is something that we have to coach through patients is the first opportunity cost is that productive output. So if you're more of a high functioning professional and you're operating 60, 70% of your cognitive and physical capacity, which is where like most of my patients are when they come to see me, what is that costing you? If you run a business, you make decisions, you lead people, you generate revenue, your cognitive performance is your most valuable professional asset. And operating with brain fog, fatigue, mood dysregulation, it's not just uncomfortable, it's expensive. If optimizing your function gets you back to 90 or 100%, what is that worth in additional output? What is that number? It's not a small number. I know that. Now, the second opportunity cost that is so important is time. Again, the conventional healthcare system is extraordinarily time expensive. The average wait time to see a specialist in the United States is several weeks to months. Then you get 12 to 15 minutes with the physician. Then you wait for your labs. Then you wait for a follow-up. Then they refer you to another specialist and you start again. The patient I talked about earlier had seen 6 different physicians over that 10 plus years. That is hundreds of hours of her life. Time off of work, time in the waiting room, time on the phone with insurance companies, time that she will never get back. And at the end of it, she still didn't have an actual concrete answer. The third opportunity cost is the compounding health decline. This is the one that keeps me up at night as a clinician because every year that goes by without addressing the root cause of a health problem is a year that problem compounds. It's not linear. Insulin resistance that goes unaddressed becomes type 2 diabetes. Chronic inflammation that goes unaddressed becomes cardiovascular disease, autoimmunity, neurodegeneration, things like Alzheimer's. Hormonal imbalances that go unaddressed, these accelerate bone loss, muscle loss, and cognitive decline. They're not hypothetical. These are the natural progressions of unaddressed root causes. And once you're managing a chronic disease, truly managing it, the lifetime cost of that disease dwarfs anything you would have spent to prevent it. Now, the fourth opportunity cost is your quality of life. I'm going to say something that sounds obvious, but it needs to be said. You cannot get back the years you spent not feeling like yourself. The 40s and 50s when you could have been performing at your best, showing up for your family, doing the work you care about at the level you're capable of, those years are not replaceable. This is the only true finite resource. Investing in your health isn't for vanity. It's a rational allocation of resources toward the thing that makes everything else possible. The fifth opportunity cost is what we talk about our downstream medical costs later on. And so let me give you some numbers to anchor to this. The average lifetime cost of managing type 2 diabetes, including medications, complications, hospitalizations, associated conditions, because it's not always just the one thing, is estimated at over $300,000 for the average person. The average total healthcare cost for someone with cardiovascular disease in the decade after their first cardiac event is around that same $300,000 to $350,000. These are not unusual patients. These are the predictable outcomes of the chronic inflammation, the insulin resistance, and the hormone disruption that the conventional system catches often far too late. Now, prevention is not just cheaper. Prevention is exponentially cheaper. And yet, we culturally accept that spending enormous amounts of money on disease management while hesitating at the cost of prevention, that the hesitation is one of the most expensive decisions that a person can make. And so how to think about it is to think about your health as your most important asset as an investment. I want to give you a framework for thinking about this that is different from how most people approach their healthcare spending. When a high-performing professional evaluates a business investment, they don't just ask, what does this cost? They ask themselves, what is the risk of not making this investment? And what does this enable that wouldn't otherwise be possible? Now, if you apply that framework to your health, what is the return on getting your hormones optimized, having more energy, better cognitive function, improved body composition, better mood, emotional regulation, better relationships? How about sharper professional performance? What's the return on healing your gut? A reduction in inflammation, better immune function, improved nutrients absorption? How about the reduced risk of chronic disease? What is the return on having a complete clinical picture of your biology? Well, you stop guessing. You stop spending money on things that don't work. You get a protocol that's actually designed for you and for your system. The return isn't an abstract, it's a measurable. I track it in biomarkers at every follow-up, and it compounds. The better your health, the more everything else in your life will function at a higher level. And so what is the risk of not making that investment? Well, we just went through that compounding decline. It's preventable chronic disease, lost years of performance and quality of life, eventually medical costs that dwarf what the prevention would have actually cost you in the first place, because there's a window of time at which prevention is an option. Now, what does this enable? It enables you to have a version of your 50s and 60s that's not about managing decline, but about continuing to build. And that's not a small thing. Look around you. How many people do you know in their 50s or 60s who are optimizing their health, who are managing and actually building their health, not just managing 100 different diseases? I'm not telling you that functional medicine is free. It's not. I'm telling you that when you look at the full picture, not just the invoice, but the opportunity cost of the alternative, it's one of the highest return investments you will actually ever make. Now, let's get into a little bit about who this is for and maybe who this isn't for, because it might not be for you and it might not be for everyone. And I want to be straightforward with you about who Ascend Functional Health is designed for and who it isn't. We are not for the person who's looking for the quick fix or the cheapest possible option. We're a premium protocol-driven clinic model. We invest significant resources into every patient, advanced testing, personalized protocols, comprehensive follow-ups. It's a lot of time that I and my team put into it, and that has a cost. We are for the person who has decided that their health is not a place to cut corners, that they understand that the body is a system, and that system deserves the same level of attention and investment that they give to their business, their home, their relationship, their retirement account, who's done accepting normal when they know they're capable of a lot more. If you've been on the conventional carousel of medicine and you've had the copays, the specialists, the prescriptions, and you still don't have the answers you want, I want to have a different kind of conversation with you. I want to have the conversation that starts with a complete picture and ends with a protocol that's actually built for your biology. And if you've never tried to get to the root cause because you assumed it would be too expensive, I want you to do what a lot of my patients do. Get a piece of paper, add up what you've already spent. Ask yourself, is this status quo actually cheaper? Now, I know that this episode can ruffle some feathers. It can make people uncomfortable to have these kind of conversations. And I even debated whether or not I was going to film this. But I think it's at that point in our country right now where people are not understanding that they are just a piece of they're just a rabbit on a wheel in this conventional medicine model. And you're getting just worked through a system that isn't designed for you. It's designed for managing, hundreds and thousands of different people, and it's never going to really be personalized. And so, I want you to stay with me here. Next week, episode 3 of this miniseries, we're going to do a clinical breakdown of why the things you've already tried, the diets, the medications, the supplements, even from the health food store, haven't produced lasting results. And it's not because you did anything wrong, but because those approaches weren't designed to address the root cause and they weren't personalized to you. And that's a significant conversation worth having. If today's episode connected with you, if you've been hesitating on the cost side of things and this maybe reframed how you're thinking about it, come talk to us. A discovery call costs you nothing. We'll look at where you are, what you've tried, and we'll be upfront too if Ascend Functional Health is even the right fit for you. The link is always in the show notes, ascendfunctionalhealth.com. I'm Dr. Alessi. Thank you for joining me today on Health Decoded, and I'll see you next week.
Thank you for tuning in to Health Decoded, where we break down the truth about all things health and empower you to take charge of your well-being. If you found value in today's episode, please subscribe, leave a review, and share it with someone who needs to hear this. For more resources, personalized support, or to have your questions answered live on the show, visit Ascend Functional Health and head to the contact page to connect with us directly. Until next time, stay curious, stay empowered, and remember, your health is in your hands.